Welcome, everyone. Today we embark on a journey into the intricate world of dementias, seeking to unravel the mysteries surrounding cognitive decline. Join me as we navigate through the complexities of this topic, aiming to gain a deeper understanding of the various aspects that shape the trajectory of cognitive impairment. Let's begin this exploration with a keen sense of curiosity and an open mind, ready to absorb insights that may shed light on the challenges faced by individuals affected by dementias. Dementia serves as a comprehensive term encompassing a myriad of symptoms, including memory loss, reasoning difficulties, and language impairment. This decline isn't trivial, it significantly disrupts an individual's daily life and activities. Furthermore, dementia isn't a solitary condition, but rather a complex tapestry woven from various underlying causes. Foremost among these is Alzheimer's disease, which alone accounts for approximately two-thirds of all dementia cases. This prevalence underscores the importance of understanding Alzheimer's within the broader context of dementia. In its early stages, Alzheimer's typically manifests through subtle memory lapses, often the first noticeable sign of cognitive decline. Additionally, patients may encounter challenges with executive functions, such as planning and coordinating daily activities. As the disease progresses, the memory deficits exacerbate, accompanied by the emergence of additional symptoms. These may include language impairments, sensory dysfunction, and changes in behavior, such as paranoia and aggression, which can significantly impact the individual's quality of life. In the later stages of Alzheimer's, the decline in cognitive and functional abilities becomes more pronounced. Patients often become entirely reliant on caregivers for their daily needs, reflecting a profound loss of independence. This stage may also witness the onset of incontinence, further highlighting the debilitating nature of the disease. Now, let's shift our focus to vascular dementia, also known as multi-infarct dementia, which arises from a series of strokes or other vascular events causing brain damage. These events can stem from blockages in either large blood vessels, macrovascular, or small vessel disease, microvascular. Characteristic of vascular dementia is a stepwise decline in cognitive function, often with a sudden onset of symptoms. Patients may exhibit memory lapses, executive dysfunction, language impairments, and various physical symptoms such as ataxia, hemiparesis, and dysphagia, depending on the location of the brain infarcts. Management of vascular dementia primarily centers on preventing further strokes by addressing underlying risk factors like hypertension, diabetes, and cardiovascular disease. Additionally, acetylcholinesterase inhibitors may be prescribed, particularly if the patient presents with comorbid Alzheimer's disease, aiming to alleviate cognitive symptoms and improve quality of life. Let's take a look at frontotemporal dementia, a unique form of dementia characterized by distinct features. One hallmark of this condition is significant language difficulties, encompassing aphasia, where patients struggle to comprehend, process, or articulate language effectively. In addition to language impairments, individuals with frontotemporal dementia often undergo noticeable changes in behavior and personality. These may manifest as disinhibition, impaired judgment, social inappropriateness, and the development of compulsive behaviors, marking a departure from their previous demeanor. Interestingly, unlike Alzheimer's disease, frontotemporal dementia typically spares memory function in its early stages, distinguishing it from other forms of dementia. In terms of treatment, managing frontotemporal dementia primarily revolves around addressing the behavioral and functional impairments, as there are currently no disease-modifying treatments available. This underscores the importance of tailored interventions aimed at improving the patient's quality of life and managing their symptoms effectively. Creutzfeldt-Jakob disease, CJD, is a rare yet swiftly progressing neurodegenerative disorder instigated by infectious prions. This condition precipitates a rapid deterioration in both cognitive and physical function, setting it apart from other forms of dementia. Individuals afflicted with CJD commonly undergo significant personality changes marked by mood disorders, psychosis, and a notable detachment from reality, highlighting the profound impact of the disease on their mental state. Neurologically, CJD manifests through a spectrum of symptoms encompassing myoclonus, characterized by jerky movements, ataxia, dysarthria, speech difficulties, and dysphagia, difficulty swallowing, indicative of the widespread neurological dysfunction associated with the disease. An essential diagnostic tool for CJD is the electroencephalogram, EEG, which often reveals distinctive biphasic or triphasic morphology, aiding clinicians in confirming the diagnosis and differentiating CJD from other neurodegenerative conditions. Now, let's turn our attention to Parkinson's disease and its relationship with dementia. Parkinson's disease is characterized by its hallmark tremor, often described as a pill-rolling tremor that is present at rest and diminishes with movement. Alongside tremors, individuals with Parkinson's may also experience increased muscle tone, termed rigidity, which can manifest in either a lead pipe or cogwheel pattern. Primarily recognized as a movement disorder, Parkinson's disease manifests through bradykinesia, or a slowing down of movement, which can significantly impede daily functioning. Although Parkinson's disease itself isn't classified as a true dementia, it is strongly correlated with the development of cognitive impairments, particularly executive dysfunction, as the disease progresses. This cognitive decline can pose additional challenges for individuals living with Parkinson's and their caregivers, highlighting the importance of comprehensive management strategies tailored to address both motor and cognitive symptoms. Let's explore Lewy body dementia, a unique form of dementia characterized by a blend of Parkinson-like symptoms and cognitive decline. Individuals with Lewy body dementia often exhibit Parkinsonian features such as tremor, rigidity, and bradykinesia, mirroring those seen in Parkinson's disease. Beyond motor symptoms, patients with Lewy body dementia commonly grapple with significant sleep disturbances, notably REM sleep behavior disorder, which can predispose them to falls and other safety hazards, compounding the challenges associated with the condition. Importantly, cognitive symptoms in Lewy body dementia, such as memory loss and executive dysfunction, typically emerge either before or concurrently with the onset of Parkinsonism, underscoring the intricate interplay between motor and cognitive impairments in this disorder. This intertwined presentation necessitates a holistic approach to management that addresses both the motor and cognitive aspects of the disease, aiming to optimize quality of life for affected individuals and their caregivers. Let's delve into the nuances of Parkinson's disorders, each presenting with its distinct features and clinical manifestations. Parkinson's disease stands out as primarily a movement disorder, where cognitive symptoms typically emerge as the disease progresses. Patients commonly exhibit classic Parkinsonian features such as tremor, rigidity, and bradykinesia. In contrast, multiple system atrophy, MSA, extends beyond motor symptoms to encompass significant autonomic dysfunction, including orthostatic hypotension and incontinence. Additionally, cerebellar ataxia may be present, adding to the complexity of the clinical picture. Lewy body dementia, on the other hand, presents a unique profile where cognitive symptoms often precede or coincide with the onset of Parkinsonism. Alongside Parkinsonian features, patients grapple with significant sleep disturbances, notably REM sleep behavior disorder, further differentiating Lewy body dementia from other Parkinson's disorders. Understanding these distinctions is crucial for accurate diagnosis and tailored management strategies, ensuring optimal care for individuals affected by Parkinson's disorders. Let's check out the diverse treatment approaches employed in managing various forms of dementia and Parkinson's disease. Firstly, acetylcholinesterase inhibitors like rivastigmine, galantamine, and donepezil play a pivotal role in alleviating cognitive symptoms associated with Alzheimer's disease and Lewy body dementia. By boosting acetylcholine levels in the brain, these medications help mitigate cognitive decline, enhancing patients' quality of life. In Parkinson's disease, dopamine replacement therapy takes center stage. Levodopa, often supplemented with a COMT inhibitor, serves as the cornerstone treatment, replenishing depleted dopamine levels in the brain and ameliorating motor symptoms, thereby enhancing mobility and functionality. However, treatment extends beyond pharmacotherapy. Non-pharmacological interventions, including physical, occupational, and speech therapy, along with lifestyle modifications, constitute integral components of the management strategy for all types of dementia. These supportive interventions aim to optimize physical and cognitive function, promote independence, and enhance overall well-being, underscoring the holistic approach to dementia care. By integrating pharmacological and non-pharmacological interventions tailored to each patient's unique needs, healthcare professionals can offer comprehensive care, empowering individuals affected by dementia and Parkinson's disease to live fulfilling lives to the fullest extent possible. Let's take into consideration the strategies for preventing dementia, emphasizing proactive measures individuals can take to safeguard brain health and mitigate the risk of cognitive decline. First and foremost, maintaining optimal cardiovascular health is paramount. Controlling risk factors such as hypertension, diabetes, and high cholesterol not only reduces the likelihood of vascular dementia, but may also slow the progression of other forms of dementia, highlighting the intricate link between heart health and brain health. Engaging in mentally stimulating activities is another potent tool in the arsenal against dementia. Activities like learning new skills, reading, and socializing can bolster cognitive reserve, fortifying the brain's resilience against age-related changes and potentially delaying the onset of dementia symptoms. Adopting a holistic approach to lifestyle is equally crucial. A balanced diet, regular exercise, and effective stress management not only promote overall well-being, but also contribute to brain health, reducing the risk of developing dementia over time. Caring for a person with dementia can exact a significant toll on caregivers, both emotionally and physically. Offering caregivers emotional support, understanding, and opportunities for respite is paramount to safeguarding their well-being and ensuring continued quality care for the patient. Incorporating therapeutic activities into the caregiving routine can serve as a powerful tool for enhancing the quality of life for both the patient and the caregiver. Activities such as art, music, or pet therapy not only provide moments of joy and connection, but also instill a sense of purpose and meaning amidst the challenges of dementia care. Furthermore, facilitating access to support groups, educational resources, and community-based services can empower caregivers to navigate the complexities of dementia care more effectively. By connecting caregivers with peers facing similar challenges and equipping them with knowledge and resources, we can help alleviate feelings of isolation, enhance coping mechanisms, and prevent caregiver burnout. Ultimately, prioritizing caregiver support is essential not only for the well-being of caregivers themselves, but also for ensuring the provision of high-quality, compassionate care to individuals living with dementia. By fostering a supportive environment that acknowledges and addresses the needs of caregivers, we can create a more sustainable and resilient caregiving ecosystem, enriching the lives of both caregivers and those they care for. Let's appreciate the promising trajectory of dementia research, highlighting key areas of focus and potential advancements. 1. Biomarkers for early detection. Research is identifying reliable biomarkers, such as specific proteins or genetic markers, to revolutionize early detection and diagnosis of dementia. This aims to facilitate earlier interventions, ultimately improving patient outcomes and quality of life. 2. Innovative treatments. Innovative treatment modalities, including immunotherapies and targeted therapies, are being developed to halt or slow the progression of neurodegenerative diseases like Alzheimer's and Parkinson's. These approaches target the underlying mechanisms driving dementia, paving the way for more effective treatments. 3. Prevention and management. Investigations into lifestyle factors, environmental influences, and targeted interventions aim to develop comprehensive strategies for dementia prevention and management. Leveraging the concept of cognitive reserve, researchers seek actionable steps individuals can take to reduce their risk and enhance brain health. 4. Personalized care. The future of dementia care is moving toward personalized approaches, considering individual genetic profiles, risk factors, and disease subtypes to optimize treatment outcomes. This precision medicine approach offers hope for improved outcomes and quality of life for individuals living with dementia. Advocacy and awareness are crucial in the fight against dementia, playing a pivotal role in improving outcomes for individuals and their families. 1. Raising awareness. Increasing public understanding of dementia helps combat stigma, promote early detection, and foster community-based support. Awareness empowers individuals to seek timely diagnosis and access appropriate care and support services. 2. Advocacy initiatives. Advocacy drives systemic change, ensuring the needs of individuals with dementia and their families are prioritized. By lobbying for increased research funding and improved care access, advocates advance innovative treatments, support services, and policies. 3. Collaborative efforts. Collaboration among healthcare providers, researchers, policymakers, and the community is key to addressing dementia's challenges. Leveraging collective expertise and resources leads to holistic approaches in prevention, diagnosis, treatment, and care delivery. In conclusion, advocacy and awareness offer hope for a future where those affected by dementia receive the support, care, and resources they need to live fulfilling and dignified lives.